So good afternoon. I want to start by thanking General Jim McConville, Chief of Staff of the U.S. Army, for his support and for taking the time today to come visit us here in the Commonwealth and at the BCEC. But of course, being a native of Quincy, he's not that far from home, and I do want to welcome him back and say that anytime, General, you want to come hang here with us in the Commonwealth of Mass, we're thrilled to have you with us. General McConville is here to see firsthand the important work the men and women of the Massachusetts Army National Guard have taken on to support our COVID response efforts throughout the Commonwealth. General Keefe and his team have led the Guard in executing each mission they've been assigned, and there have been many, with efficiency, and they continue to be an integral and critical part of the state's COVID-19 response. We're extremely grateful to the men and women who have stepped up across the state to assist at the Department of Correction facilities in building out our field hospitals, supporting public safety officers, and performing testing at long-term care facilities. So far, they've made an enormous difference in so many ways. And they were also instrumental to establishing the Boston Field Medical Station here at the Boston Convention and Exhibition Center, Boston Hope. We just had an opportunity to take a bird's-eye view of the facility, and I just want to take a minute to thank Boston Mayor Marty Walsh and his team for all that they've done to help coordinate the effort, as well as Partners Healthcare, who's leading the clinical care efforts in partnership with Boston Healthcare for the Homeless, as well as B.I. Leahy, and so many other folks in our healthcare community to set this up. These field hospitals are crucial in reducing the strain on Massachusetts' healthcare system and have helped us add a significant number of beds as we deal with the surge. The Boston Field Medical Station will provide an additional 1,000 beds for COVID-19 positive patients, and they began caring for patients last week. I do want to say at this point that this whole facility was set up and stood up in about 6 or 7 days. And a big part of that effort was led by David Gibbons and the folks here at the Convention Center, but especially by General Jack Hammond from home base here in Massachusetts. I was on the phone with City of Boston folks and folks from many of the major Boston hospitals, and we were talking about the fact we needed to find somebody who literally that day would be able to start the work associated with setting this place up. And several people texted me in the middle of that phone call and said, maybe Jack Hammond would do this. And I've known Jack for many years, and many people here in Massachusetts and around the world know him because of the work he's done leading Home Base, which is probably one of the most important organizations in the country in helping men and women in the military deal with PTSD and TBI. But I called Jack when I got off the phone, and I said, how would you like to lead the effort to stand up a field hospital at the Boston Convention and Exhibition Center? And by the way, I'd like you to start this afternoon if you can do that. And Jack called me back, I think it was less than a couple hours later, and basically said, where do I go and where do I sign? And Jack, I just want to say, on behalf of the people of the Commonwealth, and especially on behalf of the people who will be served here and saved here, thank you so much for your willingness to bring all of your experience, your energy, and your expertise to this task. And honestly, I don't think we would have got there as fast as we did or as well as we did without you. God bless. Patients from hospitals both within the Partners Healthcare system and outside the Partners Healthcare system will be cared for at this facility, and the goal is to deliver care to patients that do not require hospitalization in an acute care facility. Now, in many cases, that's going to be people who are stepping down from a hospital-level stay so that other people will be able to come in to take the beds that they were in an acute care or an ICU setting. And based on the conversations that we just had upstairs with the folks who are involved in this, they now have roughly 90 folks in this facility. Is it 90 or is it more like 150? 150. It's 90 and 60, right? Okay. 90 on the hospital side, 60 on the respite side. Based on the conversations we had, it's working pretty much exactly the way it was intended to work, and I think for all of us, in some respects, that's a big, big relief as we move forward through the surge. We'll obviously continue to respond with every resource we have to ensure that we're providing the appropriate level of care to everyone here in the Commonwealth that needs it. This work would obviously not be possible without the healthcare workers who are here in the front lines, as well as many of the active duty and National Guard personnel who are also stepping up to provide support and service here, along with so many municipal and state folks from law enforcement and other parts of state and local government. And we are immensely grateful for everything everybody's doing to take care of people and help keep people safe here at the BCEC. And I should just say that if there are other healthcare workers who are interested in joining efforts here, they should visit www.partners.org/Boston Hope. Before I turn over to General McConville, I just want to give some quick updates on testing and personal protective equipment and hospital capacity. Yesterday here in Massachusetts, we conducted 7,971 new tests for a total of 148,744 tests conducted so far here in Massachusetts, which makes us a top 5 player in terms of testing per capita in the United States. There were about 2,221 new positive cases reported yesterday, and as you're aware, one of our #1 challenges remains making sure we deliver personal protective equipment to frontline workers, and we'll continue to secure that through whatever means we can. As of yesterday, we've made over 4 million PPE deliveries across the state since the outbreak. That includes almost 2.5 million gloves, over 370,000 aircraft masks, almost 200,000 gowns, and 437 ventilators. In terms of hospital capacity, we continue to monitor the situation at the hospitals and health centers across the Commonwealth. But generally speaking, as I said yesterday and the day before, people feel pretty good about where we are with respect to that, and that's been an important part of the way we measure our success, and not just managing the surge so that we can take care of people who are dealing with COVID-19, but to also make sure that our healthcare system has the resources, the capacity to take care of people for all the things that the system normally takes care of people for. I can't stress this enough. The work that's been done, I've said this several times over the course of the past 3 or 4 weeks, the work that's been done by so many people to set up so much capacity, both inside and outside our existing hospital system, so that our hospital system and our healthcare system would be prepared to deal with and manage our way through the surge associated with COVID-19, was in part to make sure we had the capacity, the skill sets, and the equipment and the support teams in place to make sure that we could help everybody who had COVID-19 work their way through that. But it was also to make sure that our healthcare system would not be overwhelmed by COVID-19 and would have the ability, which it continues to have today here in the Commonwealth of Mass, to take care of all the other things that everybody expects a world-class healthcare system like the one we have here in Massachusetts to be able to do. So, if you're dealing with something yourself and you don't feel well, you should absolutely call your clinician and make sure that you're not worried about the system's ability to meet your needs. The system can do that. That was a big part of why we all put so much work into building this excess capacity. Let me just close by saying this. Like so many things that have been forced upon all of us to change or adapt to in the wake of this pandemic, Massachusetts obviously looks a little different this weekend than it normally would. If it was a typical year and it was around this time of year, we'd all be well underway with the final preparations to welcome thousands of runners to the state who would be participating in the Boston Marathon on Patriots' Day. This year, while the race will not be taking place on Monday, the sentiment I think we all feel here in Massachusetts on Marathon Monday remains true, and that's that Massachusetts is strong, we are resilient, and we can run any marathon anybody wants us to run. We'll get through this crisis and we'll get through it together. But it's important that people and runners take the guidance and advice that so many folks in public life, including the mayor of Boston, have put out over the past couple of days and refrain from visiting the start of the race in Hopkinton, the end of the race on Boylston Street, or attempting to run the course. The many men and women that support the Boston Marathon include thousands of local, state, and federal law enforcement, members of the National Guard, and thousands of medical personnel. Those folks are exactly the folks who are currently helping us battle COVID-19, and they need to be able to focus on the work and the task at hand. Do not divert these incredibly critical resources away from the cities and towns that are along this course over the course of this weekend or on Monday. Everybody needs to continue to do what we have done so well for the past month or so, which is to stay at home, follow all the distancing guidelines and criteria that we've set up, wear a mask or a face covering if you can't keep distance between yourself and the people you come in contact with, so that we can stop this disease and run the big race that everybody thinks of as a signature event here in Massachusetts and in the city of Boston on September 14th.